All right, let's do this thing. No intro. We're going right into this one.
All right. So, what's your name?
My name is Luther Nyrenda.
Where are you from?
Actually, let's do it again. Luther Chagumula Nyrenda. I was born in Malawi, Africa, but raised in Columbus, Ohio.
What program do you go to?
I am not going to name the program just because for education reasonings and tried to limit the affiliations, but I actually go to school in the East Coast. Before CRNA school, I had 1 full year of ICU training, and that was split between pediatric ICU and then a adult ICU where we saw surgical, not really cardiac, but usually like respiratory issues and things like that. In undergrad, I think I had a 3.7 GPA, and I scored in like the 100s for my CCRN, and high school doesn't matter.
RNA.
I remember being in clinical during my sophomore year of college. We had gone to our clinical site and we're just having a sit-down meeting with our clinical instructor. She asked us all what we wanted to do with nursing. So we kind of went around the circle, and somebody mentioned Certified Registered Nurse Anesthetist, and I didn't know what that was at all. And I kind of asked some more questions about that. At that same clinical site, we got 8 hours of shadowing. So I went and shadowed for 8 hours, and it was crazy. I don't remember a single thing. And I think that just kind of tells you like how hectic of a day it was. And then I just further explored into the option of going into that. So that same year, I emailed the program director where I'm at right now and met with him, and he was the smartest person I knew at that time and really just inspired me to keep learning, to keep growing, challenged me and challenged what I knew. Really wanted me to know the why of things and not just explaining stuff. Trying to get more into the details, and it was just a tumbling effect for me, honestly.
Accepted into CRNA school.
The hardest part about getting into CRNA school, I think, is being able to push yourself out of your comfort zone, whether that be in your personal statement, whether that be in getting more clinical experience, doing research. I think that what sets you apart is the things that make you you. And I think that is what's difficult is people want to follow a mold. And I think that hurts people when they're trying to apply. Like if you're trying to be the best ICU nurse or the student you think they want, that's not really going to resonate because they want to like you as a person. They want to see you grow. And they want to integrate you into their culture, not necessarily already have you perfectly molded from other people or things. So my favorite blade is the Mac blade, and I do love using the Miller. If we're doing a pediatric case, it's always the Miller, but I believe that the Mac blade just gives me more control, and I think that in a situation where I needed to emergently intubate somebody, the Mac blade I think I could utilize for most people. The Miller is nice. You could use a Miller 3 on anybody, they say, but you might get a really high sympathetic response afterwards too. So for me, with stress relief, I think that you need to learn how to detach yourself from your clinical experience, whether your day is good or bad. Try not to take it home with you, which is hard, especially starting out, but finding things like the gym. For me, when I started CRNA school, I was like, okay, I'm going to start going to the gym, and now it's become my routine. I go maybe 5 to 7 days a week. I try to go after clinical, so I get my stress relief there. I also think that getting out of your house is good for you, going on walks. I love biking, just enjoying people in your life as well, trying to find ways that or things that were always fun for you or just exciting. Don't lose the thrill of your everyday life just because you're in school.
Or professional challenge during this journey.
My biggest challenge, I think, is you need to learn how to separate yourself from your clinical persona. And what I mean by that is just because you have a bad day in clinical does not mean you're a failure, you're a bad person. Those are expected things to happen. Not every case is going to go perfect. There's things outside of your own control. Not every preceptor you have, whether they're a CRNA or anesthesiologist, is going to be nice to you. And that goes for surgeons or the nurses or any of the ancillary staff that you'll be working with. So learning how to detach that and knowing that criticism is meant to be constructive, and if you take it as such, it's easier to swallow versus seeing it as a attack on your ego or attack on who you are as a person. Those things can kind of linger on and will make you worse during clinical if you let them eat at you the wrong way. I think the most interesting thing that I learned during my training with anesthesia is the amount of physics principles that are incorporated into our daily lives, and how they impact how we deliver anesthesia, and how they affect surgeries and things like that.
Considering CRNA school.
My advice would be to prepare yourself emotionally for everything that comes with getting into CRNA school, whether that be failures in actually getting accepted to the program you want to get into, whether that be constant criticisms that you might get each day, the personalities that you have to manage within the OR and outside of the OR. I think that the emotional aspect of what we do and who you have to be is kind of not discussed very well and not something that we train ourselves in. I think the biggest misconception that people have in the role of the CRNA is something that you see often in those Reddit forums. I would not recommend whatever specialty you're in to go looking into those, but is a lot of people consider CRNAs or nurse anesthetists to just be nurses. That's always kind of like a stab at our profession, is that we're just a nurse. And I think that just downgrades the training, the years of devotion, the eagerness to become and integrate into the care team. Like, all those things incorporate into what a CRNA really is. And I think that the phrase, you're just a nurse, is such a degrading thing. And it's one of the biggest misconceptions overall. But those are just people, with a Twitter finger. So take it as it comes. So the meme that comes to mind for me is the meme of the dog that's in the office and everything's burning around it. And I think the textbook says everything's fine. And I think that just illustrates how you're constantly juggling your D&P project, clinical, studying, your home life, like all those things mixed in together. I mean, it's a constant inferno, but you're just kind of taking it day by day. I always say one foot in front of the other, and you'll make it through. For me, a must-have for clinical rotations each day. Oh man, what is always in my pocket that I can't? Oh my gosh, my AirPods. My AirPods are, and I think it's funny. I think it's very like millennial Gen Z of me to say, but I really love music, and I like when I'm moving around music, and when I'm doing things within the OR, I'm also thinking of music playing and things like that. So my AirPods are a big must for me. When I get my room ready in the morning, I'll have an AirPod in. If I'm eating lunch or something, I'll have an AirPod in, just listening to music. And then when I'm actually doing stuff in the OR, like intubating, putting an IV, I'm hearing a favorite song playing in my head. So I think the most rewarding aspect of my training is doing an intervention and seeing immediate relief. I really enjoy doing procedural stuff in terms of like nerve blocks, neuroaxial procedures, so like epidural spinals, because you can immediately see within 5 minutes somebody getting some sort of relief. I think the funniest thing is when you're doing a spinal, you get CSF, put your syringe on and pull back, you inject, you lay them back. they'll start to say, "Ooh, my legs feel tingly," and you're like, "Okay, something's happening." And then, if you're in a C-section, they'll test the levels, and they'll be pinching mom, and whoever the mom is will be like, "Oh, what's going on? Oh, I didn't feel anything." Or you'll do a nerve block with somebody who has like a terrible shoulder, and they'll be like, "I can't lift up my hand," and you just know that you've provided them some relief in some way, and that it'll help with the surgical procedure and the after effects as well, depending on what you put in your nerve block.
You while under anesthesia.
The funniest thing that someone's ever said to me under anesthesia, so I always like to joke with people, and I'll say, all right, in a little bit here, I'm going to take you to the beach. And some people will say like, "Oh, I've never been to the beach," or anything like that. So what I'll say is I'll be like, "Oh, where do you want to go? Like, what's something you like to do?" So I had this one patient who said, "Oh, I love to go fishing." So I said, "All right, let's go fishing." So we're rolling back to the OR, and I said, "All right, can't wait to go fishing with you." And, the patient's laughing. We move over to the other bed, get my monitors on, get the oxygen mask on. I'm about slowly pushing my medications, and the next thing I say is, "All right, we'll see you at the water." So case goes, everything goes fine. Wake the patient up. I pull the tube out of the patient's mouth, and suction their mouth. Everything's fine, and the patient looks at me and says, "I caught a big one." And I thought that was the funniest thing I've ever heard, because to them, they went off to this place, like they thought about going fishing before they went to sleep. They went fishing, and they just had to tell me about it. So it was awesome.
What's your favorite medication to administer?
My favorite medication to administer is Precedex, or known as dexmedetomidine. Don't ask me to spell it. The reason it's my favorite is because, one, it has a lot of multi-use cases. It can be used in neuroaxial anesthesia. It can be used a lot of times in blocks. It's great intraoperatively if you know how to use it. It's good for younger adults, for agitation at the end of the case. It's also really great for little kids. And it has a pretty safe profile overall. We use it sometimes in obstetrics as well. And another thing about it is that when I first met with my program director, he explained to me how Precedex worked. I was able to tell him that was an alpha-2 agonist, but he kind of drew me a picture, really got into the weeds of everything, and it really left an impression on me. So it was something where I read all about it. I read so many different things, and it's just something that I use most days in the OR, and it hasn't done me dirty yet. The way that I personally have dealt with imposter syndrome, or how it has manifested for me, is I am pretty young for my profession. I got in with a year of clinical experience, and what that really resonated to me was that I don't have the years of commitment that some of my classmates have had. Some people have 3 years, 5 years, 10 plus years of experience as a nurse in different specialties or just in ICU care. But I think that the way that I deal with imposter syndrome is that there's people who believe in who I am and what I can accomplish. So if you think about it like that in your own situation, there's people that are counting on you, whether it be your patients, whether it be your family, whether it be your faculty, even your classmates. So I think that if you allow them to lift you up, you can feel those warm hands on you as you have a hard case, as you struggle through a hard exam or just anything in life. And I think that if you just remember that maybe if you lack in one area, you can exceed in another. Whether I don't have a lot of clinical experience, I can back it up with my knowledge base. I can learn more. I can study hard. I can prepare really well for my cases. Maybe I haven't done a bunch of A lines or central lines or certain type of nerve blocks, but my preparation is where I can exceedingly just help myself achieve more and get better. And as you go through it, imposter syndrome gets less and less. But some days you go to clinical and you'll meet somebody who's the smartest person that you ever met. And then the next day you'll meet somebody else who's the smartest person you ever met. And that does get hard, but one day that will be you to somebody else.
What qualities make someone a great CRNA?
I think 3 qualities that make someone a great CRNA are flexibility, humility, and preparation. I think that most of my clinical preceptors will say that I'm always prepared. I try to look up all relevant information to the patient. So if I'm doing cardiac, I'll look up the carotid duplex. I'll look up the echo. I'll look up any like angiograms that have been done, anything like that. If it's obstetrics, I look at prior pregnancies, pertinent labs. So you have to cater to the case that you're doing and what things are important for that patient. And also the comorbidities that that patient might have. And then you have to take all those things and incorporate them into the surgery that is going to be performed, and how are you going to facilitate that. Humility is, I think, the biggest and the most important factor. Humility is the ability to understand that even after all the years, after all of the same types of cases, you can have a situation where everything goes not as you expected, or maybe that day you're just not doing well with your skills. Right now, I was going through a peripheral insertion of IVs, just like having the hardest time, and I could throw in an A line, I could do a central line for you, intubate pretty quickly, but those IVs were just getting the best of me. So it's always taking the time to revert back to your skills, communicate with other people that you work with, and get their tricks, get their tips. How do you do this? Like, what's your approach to these things? Because what that shows is that in the face of adversity and challenges within your day, you can always rely on those people around you. And that makes you a better provider, and it makes you a better team player as well. And then I think that flexibility is the last important quality, because your day can change, cases get canceled, surgeons want to do different things. You might have thought you're doing a general anesthetic, and they say, okay, we actually can do this under a MAC anesthetic. Do you think you can do that? And now you have to change that entire plan that you came up with the night before, you wrote all these notes for, or whatever you put into it, and now you have to perform. So having a plan A, B, C, D, and so on and so forth is so important in what we do, because you might try to intubate somebody and you thought you're going to have a great view, and you look in there and you're like, I can't see a single thing. So now you have to ask yourself, is it something where you can utilize a bougie device? Is it something where you need somebody to grab a laryngoscope, a video laryngoscope for? So be flexible, be humble, and just know that everything can change, and the more prepared you are, the better you'll be able to take on the day.
What's one thing, or what are the best shoes for a clinical day?
The best shoes for a clinical day are right here. These are Birks. They have seen me on my best days and my worst days. I really like how comfortable they are. You can wear whatever socks with them. And I've had these Birkenstocks specifically for like 6 years, and they've worked perfectly. They're a little bit pricey, and the only thing is that this does have some wear and tear to it, but you can send these back. And here's Camden smelling them, because I'm sure they smell funny. All right, bye, Camden. The one thing I wish I knew before starting CRNA school, or that I would tell other people, is that you need to take everything as it comes. And an example is I was on the treadmill the other day, and I really didn't want to do the 15 minutes of cardio that I had ahead of me. But as I got on, the thing that I kept telling myself was just put one foot in front of the other. And what ends up happening at some point is the steps that you have in front of you are less than the steps that you have behind you. You have accumulated so many more steps in that time frame, and the end goal is slowly approaching, and your beginning point has gained so much distance. And if you just keep remembering that and just keep pushing and just keep putting that one foot in front of the other, eventually it has to come to an end. It's like the saying, all bleeding stops at some point, right? Like, and all suffering stops at some point too as well. So if you just keep that mindset and keep your head up, stay grounded, you can accomplish whatever you need to. You can take on that hard case. You can get that grade you want on the exam, and you too can also be a CRNA if that's what you want to pursue.
And how?
The biggest impact on my journey, I hope my program director never sees this, because I would say that he has had the biggest impact on my journey. I was a sophomore in college, and I had, in some ways, and some people would say, no business like being interested in becoming a CRNA when I haven't become an ICU nurse yet. But I sent an email, and he emailed me back. He said, meet me on this day in my office. I went, and he talked with me for 30 minutes. And that was one of the few times in my life where like somebody saw something in me that I hadn't seen in myself yet. I feel like I've always been a big planner, big visionary, and he was just seeing like what I could become before I had even like noticed it myself. And that motivated me more than anything. It put, like I always say, like a battery in my back. And since then I've been, running ever since. So I've been an Energizer bunny since then. But I think that the people that believe in you are sometimes the most shocking people, and they're going to push you really hard, and they're going to challenge you in ways that maybe you think you can't handle, but I'm sure you can, and you have to believe in it too. If they can believe, also you can too.
Your specialty and why?
My favorite anesthesia specialty is obstetrics, and it's pretty surprising because one, I'm a male, but I really love obstetrics for the birthday parties that you get to have each day, hopefully, and the multitude of birthday parties. That's something I always like to say when I'm leaving a room, is like happy birthday or congratulations and I hope you have a great birthday party. The interaction and fun you can have with obstetrics is great, and in a way that's how I connect to my patients, is just trying to bond with them during their epidurals if I can. Some people are in a lot of pain, so they don't really want to talk. They just want you to, work as quick as you can. But you come back in 30 minutes and they're way more comfortable. They're happy to see you. And also with like C-sections, you do a spinal anesthetic, and you can just talk with the mom the entire case. You get to learn about their life and learn about their home, and the excitement that you get to see on mom and dad's faces, or mom and family's faces, or whoever is in the room, is something really unique. It puts it in perspective for you that you provided a service, and that came out to be a life. You're not necessarily, I'm not in there opening up the stomach and taking out a baby, but I like to think that I had a small part in that person's day. And the crazy thing is, in OB, is that I am one of the first few people that a lot of babies have seen. So those babies one day might see me on the street. Is that you, Luther? I'll be like, oh my gosh, I'm a miracle maker. I would tell someone who's considering anesthesia that what we do is a facilitation role. And what I mean by that is we provide anesthesia in most cases for procedural or surgical events, right? And what that goes into is that you have to build relationships with those people who are trying to do those procedures or surgeries. And what blossoms out of that is a working environment where you feel that the surgeon, the staff in the room trust in your skills as much as you trust in them to perform in a way that's the safest for the patient. And it's a specialty where, as much as we pretend that, oh, we get to have these patients who are asleep and, oh, we're just going to sit back here in our chair, it's not really that at all. A lot of people who are in anesthesia are conversationalists, are people who want to engage with other people. And through that, we are able to find the best options for our patients and to achieve those great outcomes that we want to.
Failure.
I think that for anyone pursuing anything in medicine, I think that you have to understand that failure is expected. And I think that we don't discuss it enough. I think that we look at our attendings, our experienced providers, and think that they are without failure. But for them to get to where they are and for them to be able to teach you and to navigate you through situations is they've experienced it themselves or seen similar situations. And within failure is growth. It's also within failure is doubt. It's sadness. It's bashing on yourself. But through all of that comes a better you. And I think if you remind yourself that, it will pay you in dividends. In our practice, because we're in healthcare, I think that the word failure scares a lot of people because that necessitates a bad outcome. But failure can just be, maybe today you weren't the best at intubating. Maybe today you missed a few IVs. Maybe you extubated a patient and, the patient's coughing and everyone in the OR is just staring at you and you feel embarrassed. Like, those are all failures and they're all going to feel like they stack up against you. But I promise you, the person and that version of you later on is thankful for all of those times that you were able to fail in an environment where you're a learner and there's people surrounding you that want you to be better. And at some point, sooner or later, if you just do the work, keep your head up, one foot in the other, you will become better. All right, I want to thank you guys for watching. I appreciate you taking the time to spend with me out of your day. That was 25 questions with a SRNA student. Luckily, I'm in a weird break, so we're going to try to make some more videos for you guys. And, it's the holiday season, so make sure to like and subscribe. Please. I ain't making no money. I'm hungry.